Okay, coming up to 2 o'clock, we're bang on 2 o'clock, so I think we'll kick off. So welcome, good afternoon. Delighted to see so many of you, all looking well and fit, and I hope you're all keeping well and fit. This afternoon's session is Danielle Adams. Many of you will know her. I'm not going to describe her CV again. It's in the newsletter that you got. But her title is Making the Most Out of Medication. Now, just before we start, most of you will not know that it's Rabbi Ket's birthday today. So I'm going to take you all off unmute, and I want you to sing a great round of happy birthday to Rabbi Ket. Is that all right?
In the end, I text messaged Nicole. I said, if you've got a spare moment, can you come round? There's something that I'm not doing right. Come round, you are doing it right. All you've got to do is to now put in the number that they gave you. There you are, you're all right.
Then disappeared.
It's all very.
Can you all stop chatting? And I'm going to unmute you just to sing happy birthday to Rabbi Ket. Is that all right?
Happy
By the way, Wednesday morning I'm coming around.
Right.
Thank you, everyone. Good thing I can edit that out of the final recording, and we're going to send you all back to mute now, and it's going to be recorded for people to watch back on YouTube. And yeah, enjoy.
Did you put that on then?
Okay. On here.
Yeah.
Okay. Right. Thank you all. That was a resounding sound of happy birthday. We've obviously got a lot more qualify for our Sage Singers group. So, Joy, you might want to pick that up. Okay, without further ado, Danielle, over to you. And we look forward to your presentation to us.
Thank you very much, Stuart.
Nice to see you.
Can you all hear me?
Yes.
Yeah, good.
Yeah.
Good. So, good afternoon, everybody. And also thank you to Daphne for inviting me this afternoon to speak to you. I've got a PowerPoint presentation, and what I'm going to do is I'm going to put it up now, and I'm going to check it's working. And then once we know it's working, then we will start. Now, normally I would like to do an interactive session, but I think on Zoom that's not going to work. So what I'm going to do, I'm going to speak for about half an hour, and then there'll be some time for questions at the end. So here goes. I'm going to share my screen, and let's see if this works. There we go. Slideshow.
Okay, I can see it.
Can you see it? I also want to try and just sort of. I'm going to sort of remove all the little thumbnail sizes except me. Does that? Can you also, you can see the screen? Yes.
They're all on mute, so but Danielle, I can see it. It's very clear. Thank you.
Fine. Okay, I'm going to start. If there's a problem, just just let me know, and then I will stop.
You carry on.
Okay. So when I was asked to speak this afternoon, sometimes it's difficult to know exactly what level and what exactly it is you'd like me to talk about. Obviously in the field of medicines, being a pharmacist. So I'm actually a mental health pharmacist, although at the moment I'm carrying out a PhD at the University of Warwick, as well as doing a bit of consultancy work. So I'm doing a general talk this afternoon, and then obviously if you do like it, and in the future, I'm always happy to come back and do something maybe quite specific to my specific field to talk about. So, right, what am I going to talk about today? Classification of medicines, I thought I'd start off with. That's sort of just some basic introduction. Then thinking about what evidence-based medicine is. Then I want to think about useful sources of information about medicines, the potential benefits of taking medicines, common problems when taking medicines, and also finally to just round off with some information about shared decision making and informed consent to have a think about. Right, this may seem a very basic slide, but there's a reason for it. So what's a drug? Well, a drug is something that we take into the body and changes the way the body works. So it could be a medicine, it could be a legal drug, caffeine.
I'm going to do it. Just sit down.
We're going to do that. Bite.
Whoever that is, can you put your microphone on mute, please? Carry on, Danielle.
Okay. So examples, as well as medicines and illegal drugs, are also things like caffeine, alcohol, and nicotine. Whereas a medicine does contain a drug, but it's in a specially prepared form to cure a disease or illness, prevent a disease, or treat the symptoms of a disease or illness. And the reason I put these slides up is that sometimes as healthcare professional, we use the word drug.
Hear anybody else speak?
Medicine. So we don't always mean illegal drugs. So sometimes when people hear the word drugs, I think, why are they talking about drugs? I don't take drugs. Well, I say that it's just to think, if it is a doctor, a nurse, a pharmacist, it may be when they're talking about drugs, they may be just talking about your medicine. It's just the way, the terminology we use. So also another general introduction, generic or branded. So majority of medicines have at least two names. One is the generic name and one is a brand name. Now this can be confusing as some generics can look different according to the manufacturer. Now for a few specific medicines such as lithium and some medicines for epilepsy, it's really important that the same brand is dispensed each time for the patient. However, due to current medicine shortages, some of these recommendations may have been relaxed. So some of you who may be on regular particular brands of medicines may find actually they've sort of seemed to have changed the rules on that. It may be that you just cannot get that brand. So I know before Brexit, there was lots of talks about medicine shortages. I don't know, I mean, at the moment there's obviously issues to do with the current COVID-19, but anyway, so whether after all this has happened, whether people will still have, whether they'll still be insisting that we have the same brand for certain conditions or not, remains to be seen. Anyway, the other thing I just need to mention here as well, that sometimes medicines are used in a way that they don't satisfy the criteria in their licensing, and that means it's being used off-label. Now, in this situation, patients should be informed and consent provided when medicines are prescribed off-label. But a lot of medicines are routinely used in this way. For example, some anti-epileptic medicines which are used to treat bipolar disorder. Also, some of the trials at the moment, the clinical trials in the treatment of COVID-19, I think rather than a brand new medicine, what they like to look at first often are medicines that may be used for something else, and that way they've got safety data and information. So I know there was a lot of talk, wasn't there, in America about using sort of anti-malarial medicines and medicines that are used for HIV patients. So this is a bit of a silly title, where do we get medicines from? I looked at that and thought it sounds like it talks about plants or something. Now what I really meant actually was about where we actually collect them from. So prescription medicines are usually dispensed at community pharmacy or local chemist or hospital pharmacy under the supervision of pharmacists and pharmacy techs. Now, this next point is really important because a lot of medicines can be bought without a prescription. And they can be bought in places like a supermarket or a petrol station or over the internet. And sometimes people think, well, if I can buy it in the supermarket, like up the road at the petrol station, well, it can't be very strong, can it? It can't be a problem. It's only something I've bought at the petrol station. Well, it actually amazes me when I'm sometimes in small supermarkets, how you can buy such a range of medicines, and actually some of them will interact and can be inappropriate for some people, depending if they're on lots of other medicines or if they've got lots of other health conditions. So if you do want advice about buying medicines over the counter, please remember to visit your community pharmacy where they will be able to give you advice. And ideally, if you can, it's often helpful to go to your regular pharmacy where you get all your other medicines, as they will have a list of the medicines that you get prescribed on their computer system, so they can check it all out for you. Now, the other thing is to think about as well is herbal medicines, homeopathic medicines, and these can be bought from a health food shop, sometimes in pharmacies or online. Now, often if we go to a clinic, we see a doctor, dentist, another healthcare professional, and we're asked what medicines we take. We often don't think to mention herbal medicines, or we think, oh, it's only herbal. But there are a few herbal medicines that can cause serious interactions with more conventional medicines. And it's important that healthcare professionals know that perhaps you're taking these medicines and whether they're right for you. One example, especially in my clinical practice, is something called St. John's wort. That is something that's become popular in mental health conditions like depression. But the problem is that it does interact with lots of conventional medicines. So we have to be careful if you're taking that with other medicines that you have sought advice first. And also, if you decide if let's say your doctor or pharmacist or a nurse recommends some other treatment for you, something like St. John's wort does take a while to sort of leave the body, so to speak. So it's no good if you stop taking it one day and taking some other medicine the next day. So it's important that you remember about these medicines and don't think, oh, it's only a herbal, it shouldn't be a problem. Majority of herbal medicines aren't, but there are some that could be a problem. So who can prescribe? Well, GPs, hospital doctors, dentists, also vets, but I thought we'd concentrate on humans this afternoon, so I didn't mention vets. Also, some pharmacists and some nurses that have been accredited to prescribe, and they're also called non-medical prescribers, as well as other healthcare groups that can prescribe specific things, other nurses and chiropodists. So what is evidence-based medicine? I mentioned that on my title page. So evidence-based medicine is based on research about a treatment to ensure that it works to treat symptoms, prevent illness, or cure disease. This is particularly important at the moment in this current coronavirus situation, because there's lots of information circulating social media that isn't evidence-based. And actually, I've received lots of information. How many times have I seen on Facebook since we first knew about this virus that Israel is going to have a vaccine next week? Well, Israel's been having a vaccine next week since, I think, January. So actually, one thing I would like to say is that if people do send you information, lots of us think we're being helpful by forwarding it on to friends and sharing, and some of it is really not based on anything particularly credible. And sometimes it can also be quite frightening for people. So at the moment, this seems to be a bit of an issue. And I did see a government-backed website yesterday that's really telling people, please don't pass on information that actually may not be particularly accurate. Just have a think where it's actually come from. It may, sometimes people say, in America, they're using this treatment. Well, actually, it could be from just a magazine that someone picked up that their friend in America has sent them a photograph of and put on social media. It doesn't mean it's actually recommended treatment. So going back to what evidence-based treatment is, healthcare professionals, we refer to guidelines such as NICE guidance to obtain the most current information, because one person on their own, one doctor on their own, won't see as many patients with a particular condition as when researchers have looked into lots and lots of papers. Something also happened recently. You may remember there was a panic buying of paracetamol recently. And that happened, and then lots of pharmacies were out of stock. And that happened because the French health minister made a flippant remark about certain other medicines, using other medicines if you had a fever, and you shouldn't be using it in COVID-19. This wasn't an evidence-based statement. It was he just made an off-the-cuff statement, and it caused a panic. So, and the same thing happened with some particular blood pressure medicines, and people started stopping taking their medicines because of it. So sometimes people are not particularly helpful. So where can you get reliable medicines information? Well, obviously your community pharmacy, I suppose I would say that, I'm a pharmacist, but it is, we have to think community pharmacies are actually probably the most accessible healthcare professionals, because you don't have to make an appointment. You can make an appointment, but many of them are open 7 days a week and open late. You can also have arranged to have a medicines use review. Now, these are currently unavailable due to COVID, but this is a chance to have a discussion in the consulting room at your pharmacy where you get your medicines from. And a local pharmacy where you do get your medicines from will have a record of all the medicines that they dispense for you. Now, many GP surgeries are now employing pharmacists, and it's worth checking with your local surgery to see if you can make an appointment for a medication review. Of course, you can get information from the GP, from hospital doctors. Now, every medicine that's dispensed has to include what we call a package insert, a patient information leaflet. And I'm sure you'll all agree, the writing on these leaflets is tiny, tiny tweets, really hard to see sometimes. But what you can do, if you do want to read it and you're struggling, you can actually download the same leaflet from this particular website, www.medicines.org.uk. Another reliable website is NHS Choices, which I find very useful, and they have an information for the public section on their website. So I think years ago we used to advise patients, oh, don't look on Google. No, there are some very good websites, but you have to also remember there's a lot of rubbish out there as well. And it never ceases to amaze me how people will ask for medical advice, again, on a general Facebook group, to people they don't know, because I've seen it before. My child has a rash, what do you think I should do, to a load of people they've never met before? Bizarre. Anyway, so risks versus benefits. So medication can improve or treat or manage symptoms of physical or mental illness, get you back going to work or out socializing, improve your well-being, prevent relapse of an illness, and promote positive health outcomes. So that can be the benefit. However, we have to weigh things up against the risk of side effects. And some side effects are imminent side effects. You notice them straight away. It may be that you might feel sleepy for some people, or a slight upset stomach. And other side effects are more long-term. And some of these long-term side effects, it's a case of they have to be monitored. It may be they have to be monitored by blood tests. So some of the common problems, now adherence is a word where we think about people not taking medicines as it was intended to be taken. And we used to think of non-adherence. I know, especially a few years ago, oh, that's really bad. The patient's non-adherent, they're not taking their medicines. But you need to stand back a bit for a moment to think, why are people not taking their medicines as they're supposed to be? Is it that actually some people, it may be unclear if they're to continue taking them and how long they're meant to be taking them for. It may be, and I've come across this before, that with the medicine shortages, they've just run out and they can't get any more, and they didn't know who to turn to in that situation. And some people have intentionally not taken them because they don't work for them, but they just haven't reported that back to the prescriber. We sometimes use the word adverse effects, also known as side effects, and often doses sometimes can be too high for someone, and then the person can experience maybe side effects, or it may not be high enough, in which case it may not work properly. Maybe some people may take too much of their medicines, and other people may keep forgetting to take them and not take enough of them. But a lack of monitoring to how effective a medicine is and the side effects, and follow up by the prescriber to see if the dose needs adjusting, or whether, of course, if the medicine is still needed or maybe changing to something else instead. And although these problems can occur any time, they are most likely to occur when a new medicine is added, a medicine is stopped, or a dose is changed. So just a few things to think about here. Problems taking medicines. Now, this might seem really basic, and I do apologise. I know there's at least one pharmacist in the audience here because I've spotted her. But I will say that sometimes I used to get reports frequently. People couldn't swallow their tablets or capsules, so they stopped taking them. But actually, sometimes that can be easily resolved. It could be there's a liquid or soluble type available, soluble tablets available. But also, of course, medicines can be in lots of different formulations. You can get patches, creams, lots of different ways of taking medicine. It's not all through by taking tablets. Sometimes it's a case that you just want you maybe be able to take 2 of a smaller dose or something like that, that may be a smaller size tablet. Or maybe sometimes the doctor will change it to something quite similar, but they're just easier to swallow. There's also problems remembering to take your medicines. Now, I have got no magic wand or formula for this because I find it really difficult myself. So, but there are compliance aids, and it's worth having a chat with your pharmacist if that's really is a problem. And also, you may be able to get hold of large print labels if that's something that would be useful for you. Hopefully, we're okay so far. So, interactions. Now, I mentioned this before, and sometimes we have to be careful if we mix medicines with other medicines or certain types of food or drink. Now, the one I can think of is some of you may be familiar with is grapefruit juice. That one comes up quite a lot. There's something in grapefruit juice, and there's certain medicines like statins that we use for high cholesterol that says don't drink grapefruit juice at the same time. I'm not sure grapefruit juice is such a popular drink as it once was, but anyway, that's the one I'm thinking about. Also, with certain medicines, if you suddenly change your diet for some medicines as well. And you have to think about prescription medicines, as I mentioned before, and the medicines you buy, and any maybe herbal medicines that you have as well. And also thinking about, I've talked about where you get medicines from, but one thing I didn't mention is that sometimes people, friends and neighbours, maybe not at the moment because we can't see anybody, is can be very helpful. And if, say, somebody says, I've got a headache, they look in their handbag and say, oh, I've got some migraine tablets my doctor gave me. These might help you. So they might mean well, but of course, if something's prescribed for someone else, it may be that not right for you. So just thinking about the different places we get medicines from, you just do have to be careful. We have to think about alcohol with some types of medicines, because alcohol doesn't interact with all medicines, but it does with some, and you always sort of tend to see it on the dispense label. Now, we've mentioned already about grapefruit juice, and I've also mentioned about St John's wort, which is something I always end up talking about. So just a few tips here to get the best out of your medicines. So now, this again may seem really obvious, but when I used to work years ago at the preoperative assessment clinic at Watford General, and we used to see patients before they came into hospital for routine procedures. And sometimes I used to say to them, right, we have a list, can we find out a bit more about the medicines you take? And then their mind would go blank, and then they couldn't remember. These days, things are we use a lot more electronic systems, so it's not quite as bad these days. But I think it's important that you do carry an up-to-date list of your medicines, and sometimes, and allergies especially, and sometimes you think, oh, it's fine, I'll remember. But if you're not feeling very well and you have to go to A&E or a clinic, and suddenly your mind goes blank, and then you can't remember anything. So just think, it's not how you feel when you're calm, it's when you might feel when you're really quite unwell. And remember all the things you buy as well, and herbal medicines. And you want to take this information with you also if you have, so it could be hospital appointments, dental appointments. Of course, dentists can prescribe. So if you were at the dentist and you had maybe an infection, they prescribed you some antibiotics, the dentist wouldn't necessarily know what other medicines you're taking. Because even today, with all our computer systems, often it's sort of separate system, and they wouldn't know. So it's important that you sort of take some responsibility for your own medicines. And if you are going to have an appointment to discuss your medicines, write down the problems you've got before you go. Now, again, it might seem really obvious, but I don't know about you, but you get into that doctor's surgery, you sit down and you think, your mind just goes blank and you can't remember, and you come out and you think, now that was annoying, I meant to ask them that, and I've been waiting for this appointment for ages. And especially when it's maybe a consultant at the hospital, you're not going again for 6 months. So although this might seem really obvious, it is really important to do. And also, the other thing is sometimes you come out of the consultation, you think, oh, I forgot to ask. So this is a few questions here, key questions to ask about your medicines. You know, how long do I need to take it for? When would I expect it to start working? Because sometimes people give up taking their medicines after, let's say, a week. I've taken it for a week, it doesn't work. It could be that you won't see an improvement for 2 months. So you need to sort of get an idea of all of this. And it is sometimes, I think that sometimes the doctor or whoever's prescribed these medicines may have mentioned it, but there may be so much to take on board that you sort of not remember what they've said. So it's useful to, and you can also, if you forget, it could be that something you may want to take to your community pharmacy. So how do we avoid using medicines use problems? Well, obviously speaking to healthcare professionals to get advice. I've already mentioned pharmacies open most of them 7 days a week using regular pharmacies, and that's my plugging my profession. But also just to mention here that community pharmacies do offer a range of different services. For example, stop smoking, also home delivery of medication. But it's worth asking them what services they offer, because I've come across people that struggle to collect their medicines only to find out they didn't realise that actually the pharmacy would deliver. So just do ask, because it could be that you just haven't noticed. There could even be a sign up in the pharmacy, or you just haven't, it's never been a problem for you in the past. So, okay, can you, I don't know if you can see this okay, because this is covering part of my screen here, but
okay.
You can see it. I'm going to go through, hold on till we get my, right, okay. So I thought I'd just mention a little bit about shared decision making, because it does apply to medicines. And sometimes, years ago, when you went to the doctor would tell you what you needed to do, and you did it. And if you didn't do it, you were thought, well, they didn't do as the doctor told them, you know. And that's not the same nowadays. Often you go to the doctor, or it could be, say, another healthcare professional, and they ask you what you want out of it, the consultation. And I've heard people say, well, I'm not the doctor. I don't know what's the right treatment. Why are they asking me? Well, the reason they're asking you is that actually the doctor has or the pharmacist or the nurse or the healthcare professional does have the expertise in treatment options, in the evidence, in the risks, and the benefits, and the diagnosis, but they're not the expert in you. You're the expert in yourself. You know what you might prefer. You also might know, if you've had this condition before, that what worked before. You also may know, oh no, I had awful side effects. There may be choices. And I think it's really important that we understand that the patient does know best about themselves. And it's about a collaborative process here, about a discussion, but it's also ensuring that we also have access to that, to information, so we can make these decisions. Now, some of you will think, oh, but you know, if you went to the GP with a suspected chest infection and they say, yes, you've got a bacterial infection, you need antibiotics. There's not a huge amount of shared decision making there, and I get that. So I think a lot of this you may have seen when we were talking about more longer term health conditions, things like whether we're talking about heart disease, diabetes, cancer, mental health conditions. That's the sort of thing where you may come across this, where we're sort of trying to find out what's right for you as a person, because everybody is different. And this fits in with the NHS long-term plan, which is aiming for universal personalised care. So we take into account the evidence, we also take into account the patient as an individual. And this also, just to mention the legal framework here, because of course, if you don't want to take medicines, if you have the capacity under the Mental Capacity Act, you're entitled not to take the treatment, unless of course you're subject to the Mental Health Act. But if you can provide consent, the consent has to be informed consent. So we have to make sure you've got the right information. And there was a judgment a few years ago that changed this slightly, to say that we actually have to make sure, healthcare professionals, to make sure that we've given the patients aware of risks involved in the treatment, and any very reasonable alternatives. It's not really enough just for us to give you a patient information leaflet and say, well, that's it. You have to know different options. It could be whether you're going to opt for surgical procedure or whether you're going to have medicine to treat a condition, or in terms of in mental health, sometimes it's psychological therapies, talking therapies, or medicines, or maybe a mixture of both. And one of my last sort of slides here is just giving considerations to what we have to think about when we're recommending medicines to get you an idea actually that so much goes into it. So when I'm saying you shouldn't just borrow medicines from a friend if you're not quite sure what they are, is to think there's so many different things that we have to think about, whether it's the evidence-based, whether it's actually available, because it's all very well having something that, oh yes, this is the best medicine. If it's not available, you can't really have it, can you? Patient preference, allergies really important, age. Now, as we get older, our kidneys and our livers don't work quite as well. And when we take medicines into the body, medicines, the body gets rid of medicines through our kidneys and livers. So if our kidneys are not working as well, and we carry on taking maybe the same dose we did when we were younger, we may find that we accumulate too much in the body. Therefore, as people get older, for some medication, we have to reduce the dose. I have to think obviously about pregnancy, risk of pregnancy, breastfeeding in women of a certain age, and also think about other illnesses an individual may have, which might make one medicine not suitable for a particular person. Likely interactions, which we've mentioned before, swallowing difficulties, thinking about the side effect profile, and also, of course, blood test results, which may dictate what's the right dose of a medicine. Something like warfarin may be something you're familiar with. And that's the end of my talk this afternoon. So I hope you found it interesting. I regret I can't answer specific questions about your individual treatment or for a particular patient, because obviously that would be unprofessional of me, and I don't have access to notes. But I'm more than happy to take general questions. So what I'm going to do, I'm going to get rid of this slide, and I might hand you back. I think Stuart's probably going to share this bit. So let's see. Has that worked?
You're on full screen at the moment.
I'm on full screen. Do you want me to go down on a small screen? How do I do that? There. Is that better?
Hold on. Right, I can only see 9 of you at a time, so I'm not sure how we're going to get questions up. I suppose if you want to unmute yourself singly.
Can I make a suggestion?
Go on, Daphne.
At the bottom of my screen, there's something that says chat. So if people could actually write a little question on there. I'm not sure if everybody's got the chat though.
They should have, if you go down to the bottom.
Yeah, I've got that.
You got that, Danielle?
Yeah, I've got that, yes.
Yeah, I don't know if everybody's got it, but that's possibly a way of doing it. Or put your hands up.
Difficult to see everybody. Go on. Somebody wants to ask a question. Just carry on and let's see how we get on.
Who's going to ask one?
Go on. Say who you are first.
Right.
Judy Mendel.
Okay, go on, carry on.
Generic medicines should be the same as the brand that they're copying, but this isn't always the case, because my husband was on an anti-rejection drug and was given the generic one, which is much, much cheaper than the original brand. And then we had a note from the hospital to say that he shouldn't take the generic one, he must take the original brand. Is this the case with other medications?
That's a really good question, actually, because sometimes it's a very good question. When I'm trying to describe the difference between generic medicine and branded medicines, I sometimes give the example of something like washing powder. Washing powder is pretty much the same, but some people will say, no, I only use Persil, or I only use Ariel. It is different. So they're not, the actual active ingredients is the same, but some of the additives can be slightly different. Now, sometimes there could be slight differences in how the medicine works, but it wouldn't be noticeable for many medicines, because of a lot of medicines, the amount that's needed in the bloodstream is a very wide, it's not so critical. Whereas for some medicines, and there are some that has to be, it's very specific. Sometimes some medicines for epilepsy like this, you're trying to control someone who maybe got uncontrolled epilepsy, and they find just that very tiny little difference could make a big difference to the person. So yes, there are things. Now, in some people, it doesn't actually cause a problem, but usually what happens is if they've had reports, so you might find there's an NHS directive that says that we might be given recommendations, please keep to the brand. So that happened with some epilepsy medicines a while back. So it does happen with other medicines, but I think for the vast majority of medicines, there's no evidence. I mean, some people say, well, this one's much better than that. Yeah, most of the time it's really not a problem, but yes, you're right, it does happen, but they're quite few, and I think prescribers and clinicians do know which ones we tend to know which ones we should be looking out for.
Okay,
Danielle, can I ask you one about homeopathic medicines? There's a great disparity, particularly in the NHS, about believers and non-believers. There are those people who will not take any prescribed medication and go straight to the homeopathy shops and swear by them for toothache or whatever it is. But I think the NHS is largely sceptical about the power of homeopathic medicines. What's your view?
That's interesting. Years ago, there was the Royal Homeopathic Hospital, if I'm right in thinking, in London. And I have a feeling, although I've never dispensed any in my whole career, that I think there were certain medicines you could get on the NHS. That's stopped now. That's just, I don't think any CCG would commission this now. What's my view? I think sometimes, my personal view is that just because you don't understand how something works doesn't mean it doesn't work. I think that's my view. However, there isn't the evidence to back it up, and I think that's why, as healthcare professionals, it's very hard to recommend these things. And also, I'm not trained in homeopathy. One thing I would be concerned about, that not all homeopaths, but some homeopaths are part of the anti-vaccine brigade, and I'm not someone that actually signs up to that at all. I know we're desperately looking for a vaccine for this COVID, and I'm interested to hear what some of these sort of natural sort of things are people involved with this are thinking at the time. I prefer to think of these medicines as complementary, that go along with other things if it's right to take them. And also for some people, there are no conventional treatments. There isn't anything. So it may be that some things do work, but I think my view is it's important that we do tell the healthcare professionals that we're under. And also I think the healthcare professionals as a profession, I think for many years, I'm not saying me, but many of our colleagues, because we sort of dismiss these medicines, patients don't mention them to the doctors because they think, oh, they won't be interested. They'll just say, oh, they don't. But actually, I think it is important because it is part of treatment. But anyway, I don't know if that answers your question.
Okay, all right.
Thank you. I'll say something. There are years ago, there's supposed to be a very, very tiny amount of it in a bottle with homeopathic medicine, and a specialist was asked to take a test with 2 bottles if he could tell which one was the homeopathic, and he refused. He wasn't able to judge. He wasn't going to take a test to say which one. So the amount of the medicine in a bottle is minute. So it's probably largely psychological.
It's very difficult. You're absolutely right. And that's why it's very hard. Conventional science, from that basis, it makes no sense, because the weaker it is, the stronger the homeopathic medicine becomes, which is completely upside down compared to how we've always been taught, basically from days of O-level biology. You know, you think if something's more concentrated, it's going to be stronger. It's the opposite in homeopathy. So I don't, to be honest, but then just because we don't understand why something works doesn't mean it doesn't work, does it? But yes, it's but that's different to herbal medicines. Herbal medicines are not the same. Herbal medicines may come from a plant source or something, and that's not the case. They're not necessarily very, very dilute or weak. So they are different.
Does Shirley want to ask a question?
No, I do, please.
Go on, carry on.
Can you hear me?
Yes, carry
Can I
on.
just go back to the Royal Homeopathic Hospital and homeopathy. About 40 years ago, I had very, very bad migraine, and I was recommended to that hospital and a particular consultant. And within 3 months on homeopathic remedy, I was cured, and I have never had any trouble, thank God, since. So I am a great advocate of homeopathy. I don't think the hospital's there still, but people came from miles to that particular consultant. And, you know, if it does the job and you have no side effects, it must be good. Doesn't mean to say there aren't other things that will cure it, but that did it for me.
Okay.
Thank you. I think that's a really good point, because actually, in a way, it's a shame that we can't have it still part of our NHS services, because if it's regulated in a hospital setting, I seem to have gotten them. Hold on, let me go. If it's regulated in the hospital setting, I think that, you know, I think what we're concerned about with some of these treatments is about, as well, you know, maybe sometimes you might think unscrupulous practitioners are charging a lot of money, we don't know what the evidence is, whereas I think that it did have a good name, the Royal Homeopathic Hospital, and just because we can't explain how something works doesn't mean it doesn't work. And I have used homeopathic treatments myself, I have to say, for certain conditions, and I've found them quite useful. But I say it's difficult for me to recommend them as a healthcare professional, because I'm not really an expert in them. But yeah, you've actually got a valid point. We can't. It's not right to say none of them work, because they do work for some people.
I think years ago the NHS would prescribe them or recommend them, but I think their thoughts are there is no evidence-based information that makes them any better than prescribed drugs. And in fact, for some people, it does more harm than good, because they refuse to take prescribed medication. I've read about people with cancers who don't want to take the very difficult drugs they have to take, and start on herbal medicines or homeopathics, and obviously don't recover because they're not effective in that sort of area. So good and bad on both sides.
I mean, that's a very good point, Stuart, because actually you could actually be doing a lot more harm than good if you're taking them at the expense of having some really good evidence-based treatment, which for a condition, it could be quite dangerous. So it depends on what it's for. But
Can I ask a question? Can you hear me?
Yeah.
Yes. Who are you?
Anne Kassler.
Go on, Anne.
Many years ago, I had an adverse reaction, which they said I was allergic to what was then known as lidocaine. I think it's now called lidocaine. Yeah. And that has stayed with me, that allergy. I'm now posted as being allergic to lidocaine. It was given by a dentist as a local anaesthetic. And I really would like to know if I still am allergic to lidocaine, or can I find out whether I am or not? Because I have had procedures over the years, mentioned it, and they said, oh, we can't give you that. We'll have to give you an alternative like Citonest or Scandinest. So is it possible to determine?
I think that's a really good question, because sometimes with allergies, which does sound like you've got a genuine allergy, sometimes people say they're allergic. Well, what they really mean is they just had a side effect or something, and they just didn't like the medicine. But a genuine allergy can be potentially very dangerous. And
can I just interpose? I passed out.
Yeah. So because
a couple of times with it.
Yeah. It can be it can be fatal. It can be very dangerous. And because of that, I think healthcare professionals always have to err on the side of caution. So, no one would want to take the risk. So that's what it is. They wouldn't want to take that risk with you. It's better that you use they use an alternative. So even though it was a long time ago, it would be probably in your best interest if they carried on saying you're allergic to it. I appreciate you might think, well, maybe I'm not allergic to it anymore, but that's just, I think, with a lot of allergies, especially genuine allergies, where you've, especially if you've passed out, it could be very dangerous if you had it again. So it's unlikely they'd want to test you for it, actually. Just in case.
Does that mean there is nowhere to go for allergy testing?
There is. You can go for allergy testing for lots of different conditions, but I just think with something like that, sometimes as well, it can come up in the blood as one thing, and then what happens in practice can be something else. So, but unless it would be a drug that or something you had to have, because you've also got the issue that the first time you have an allergic reaction, it can happen with things like penicillins. The first time could just be a rash or something. And then if your subsequent exposure to it could be very, very serious. So I say it's not worth taking a risk which actually has got a mortality risk attached to it, really. So again, if something didn't come up on your allergy test or it was inaccurate, it's not worth taking the risk.
Thank you for that. I'm reassured. Okay. I'll stick with it.
Stick with it.
Somebody else?
Yes.
Who's that? Hello, Cyril.
Hello, Stuart. 5 years ago, I had a valve replacement in my heart. As a result of the operation, I developed Raynaud's disease. I was prescribed a tablet, but I had adverse effect, severe diarrhea. So I was taken off the tablet. I was recommended to wear thermal gloves, which I do, and they just give me local relief. But can you tell me if since I had the operation 5 years ago, has anything been developed to ameliorate the Raynaud's disease?
Just before you start, I think this is a business question. There's a 50 guineas charge for this.
Okay,
is that right?
True.
Go on.
Well, my first reaction to the question would be, well, I'm not a particular expert, although we do have a family member that has Raynaud's, so I do know what it is, and I do know that there's not that much out there, is there, in the way of treatment, other than those sort of hand warmer things, you know, where you break them and you get them in the pharmacy. Have you seen those where you sort of...
Yes, I use.
But and wrapping up one, which sounds ever so primitive, you expect, and because I know the medicines, some have side effects. I'm not the best expert in that. So if it is something next time, I mean, once we're all over with all this COVID business, or the next, or even if you can have maybe a video call if you're due to have a doctor's appointment, or your local pharmacy, maybe ask them. I say, I'm not an expert in that field. All I know is our own family member. We haven't managed to find anything either. So yeah, but it's also important that you do get this checked as well, to check there's nothing else going on at the same time, because just to check through, you may think it's just the Raynaud's, but whether there's anything else that could be done. So
thank you.
Okay. Thanks, Cyril. Anybody else? Somebody else coming in now?
Yes, another question.
Just get two.
Would you regard a spare part or come under the heading of a medicine?
I just lost you there. I don't know if it was my end.
Can you repeat that,
Would you
Cyril?
regard an electronic device or any spare part in a body as a medicine, like a pacemaker? Does that come under the heading of... No, they're not medicines. No.
Okay. Anybody else? Questions for Danielle?
Funny question.
Funny question.
Oh, there's somebody's got a hand up. Is that Barbara and Sydney?
I've got a question, Danielle. It's Louis here.
Oh, hello, Louis.
All the way from sunny Israel.
How are you, Louis?
Thank God, very well.
Family well?
Yeah, all good.
Nice to hear from you. Go on, carry on.
Thank you. The question is, medication has a use-by date. So when medication goes out a date, does its effectiveness reduce, deteriorate, or should you just simply not use it?
Well, if you're asked, it's a good question. If you're asking a pharmacist, who, if I have something out of date in my cupboard and I use it, and then other people will look at me or family say, "How could you be using that, Mum?" But anyway, the reality is it's stability data. And when you have stability data, the companies, the manufacturers of these medicines, they'll only know, they might test it up to say 3 years, or they might test it up to 2 years, or they know. In some medicines, it's particularly important because they do go off and lose effectiveness. So it depends on what medicines we're talking about. If you were to use something that, shall we say, is very, very important for a particular health condition and used out-of-date medicines, you wouldn't know if you suddenly started to feel unwell, has your condition deteriorated, or is it that the medicine's not working? And you could find then, it could be you may be prescribed a higher dose where actually it could be that the medicine's just out of date. So I would always recommend, don't take out of date medicines. Don't do what I do. I mean, often it's more to do with the effectiveness. Things like eye drops and things like that, once you open them, you've got to be very careful and use them for a short period of time, because then they may get bacteria in them, and actually then that could cause a problem if you put them in your eye, if they sort of, it's not a very clean thing to do. So I say my advice is that it does seem a waste. I have to say, we all think, well, we've got medicines over, it's a waste. But because we can't guarantee that they haven't lost their effectiveness, we have to say you have to get rid of them. So,
okay,
yeah.
Louis, how's Israel coping with COVID? Are you there?
Yes, I just wanted to unmute myself.
How's Israel coping with COVID?
Well, I'm sure many of you have seen in the media, whether it be in the UK or online, Israel is coping remarkably well, actually. Some of our lockdown restrictions are being relaxed. They're looking at primary schools years 1 to 3 going back to school. The restrictions there was at one time when we were only allowed to go within 100 meters of our home. Unless it was for medication or essential supplies. You know, we're a population of like 9.2 million. And I think when I saw the last count, there had only been, even one death is unfortunate, but there'd been like 257 deaths. And I think we're about 15,700 incidences. So I think Israel was one of the first countries to actually put the total country in lockdown and close its borders, which still remains the same. And people, I know Boris Johnson spoke about having a 2-week quarantine, possibly starting next month for people coming to the UK. But here we've had that since late March, a 2-week quarantine. Originally, people had to self-isolate in their home, and now they've commandeered, together with the army, the Home Front Command, they've commandeered hotels here in Israel, which have become isolation hotels. So on the whole, I think we've managed the situation quite well. The critical point is there going to be, God forbid, a second phase as restrictions are relaxed? No one knows. And of course, like every other country across the globe, balancing the need to preserve, save life and be as safe as possible with the need to avoid an economic meltdown. And that Israel's not immune from. And it's quite tough. But on the personal side, i.e. for citizens of Israel, it's been controlled quite well. I'm sure there'll always be people that will criticize steps that have been taken. But I think if you look at the data, the number of fatalities is remarkably low, which is a good thing.
Okay, lovely to hear from you, Louis, and I hope Israel comes up with the vaccine for the rest of the world.
Thank you.
Right, anybody else got a question? We've got a few more minutes left, if that's all right with you, Danielle.
Here's one. Here's one.
Can I have just one?
Barbara and Sydney, we've got.
Yes. Can I go? Can I ask?
Yeah, go on, carry on.
Sorry?
You can carry on.
Go on, carry on, Sydney.
Yes. Talking a lot about what's in the medicines, what experience do you have with any people complaining about how they get their tablets out of the tin foil? Is there any regulation? Is there any research been done on? Because there must be. I've got 4 different drugs, and they come at different colours and different sizes, but they're all in these wretched tin foil packs. And sometimes I've got a battle to get them out. It's quite hard. Is there anybody looking at the people with arthritic fingers? Must be a terrible situation.
That's a really good question. And one of the reasons I think it's particularly good is that if you have got medicines that you cannot open, people often, what they do is they take them all out or get someone to do it, and they put them in one of these pill boxes, and they put them all in there, all unlabeled. And it's a pharmacist's nightmare, these things. I hate them, but anyway. So people take them out, and because they can't get them out when they need them. So in fact, it's really important that you have got medicines that you can open. Now, Public Health England did produce a document making reasonable adjustments in the community pharmacy. So I would really strongly suggest that you actually have a chat, even if it's on the phone, because at the moment obviously it's difficult to get to community pharmacies, about other options, because it could be that there may be even another generic brand which is easier than the ones that you've got to maybe open. It could be a simpler foil, it could be a different, there could be something else that could be done. Have you had a chat with your local pharmacist about it?
Yes, and they don't really not very interested in it at all. I have no problem except getting into a temper when I can't get the wretched thing out. And the other point is that you get your prescription, they deliver it, and it's a different manufacturer for this one this week, time, different shape thing, and sometimes they're quite easy. Another manufacturer, you can't get them out.
The other thing you can do, and I mean, a lot of pharmacies they may charge because if it's not for a particular reason, but some of them offer these sort of blister pack systems where they put all the medicines like for the morning into like a pack, and you can do it like that. So that there are other ways. And the other thing, I mean, as a pharmacist, I'm not allowed to particularly recommend a particular pharmacy because we're not allowed to from our professional regulations. But what I will say, if you like with a GP surgery, if for some reason you don't feel you're getting the service you want, you can move to a different pharmacy or move to a different, if you think they don't offer what you may need, because some of them do offer, say, these sort of, they're usually more as reminders, like compliance aids and also things so people remember to take their medicines. But it could be that it's just easier to have them in these blister systems, and different community pharmacies offer different systems. I don't know, do you know what I'm talking about, like these things?
Danielle, I think we're talking about things, a Dosset box, aren't we, really? Where a pharmacist will give you a week's, particularly if you're taking... Oh gosh! Particularly if you're taking quite a few medicines together, and some are in the morning, some are during the day, some are of an evening. Pharmacists are very good at putting those into Dosset boxes, and you get a week's supply, a month's supply. So talk to your pharmacist. I think
it may be an option because it means you haven't got to then eat lots and lots of containers. That's what, Dosset box is the word I'm looking for. Yes.
Okay.
That's exactly.
Okay. One more question before we need to let Danielle get on with her work or whatever. One more person.
Stuart.
Yes.
Dennis Davis.
Hello, Dennis. How are you?
I think I'm okay.
Good.
I just want to give a bit of information. I waited to the very end if there was time.
Okay, good.
Homeopathic hospital medications.
Right.
There was a hospital on the corner of Great Ormond Street, until about 5, 6 or something years ago. It's now been absorbed. It's been closed and absorbed into Great Ormond Street Children's Hospital. Know quite a bit about it because my wife, when she decided she didn't want to be a radiographer anymore, she got a job there in the outpatients department. She didn't believe in it, and I certainly, as a trained industrial chemist, doesn't believe in it. But it's such an ingrained, as has been said, the people that do believe in it are so convinced by it that nothing will change their opinion. And she always related, she didn't mention the names, very, very famous people used to go to that hospital. And one of the strongest advocates of homeopathy is the Queen. The Queen travels with a homeopathic kit with her. Prince Charles also believes in it, which is not surprising if you have trees, etc. It just defies all science as to why it exists. But there's one thing, one question that Pam always used to pose, where I haven't got an answer, and she certainly hasn't got an answer. There is such a thing as homeopathic medication for animals. There are homeopathic vets, and apparently it works on animals. Now, if it is a placebo, the animal doesn't know it's a placebo. So that is the big unanswered question as far as I'm concerned about homeopathic medicine, although the science just says it's an absolute, as already Danielle said, absolute total nonsense. The more you dilute it, the more stronger it becomes. It defies any, and it's never ever been scientifically examined with a positive outcome. There's never been strict comparative tests of homeopathic medications against conventional medications.
Okay, all right, Dennis, thank you for that to round us up. Danielle, thank you very much for a very interesting presentation. I'm sure it's raised a few thoughts in people's minds, but I would like to make a plea for your local pharmacists, particularly in the current climate we're in. They are a very good first point of contact sometimes, rather than trying to get through to your GP on the phone. So, you know, we've got some very good local pharmacists for those who live in Bushy particularly. Okay, thank you, Danielle. Thanks for your time. If anybody wants to see this again or recommend it to their friends, it'll be on YouTube. If any of you want to stay and carry on chatting to each other about your nails, your hair, or your whatever, please feel free to do so. Next week, we've got Ruth Waxman, who's giving a very interesting chat on interesting women. My committee, who meet every Monday, where we sit and chat with each other, are already looking at what we can do for June. So we've got five Tuesdays, and we will write out to you in due course, hopefully with an interesting program for that. But this is the second one we've had. We had 100 people on today. So great to see you all. Keep well, keep safe, keep alert, and keep taking your medication.
Keep taking the tablets.
Thank